3,657 cases that are considered active, 42,420 samples tested in the last 24-hour period, and tragically 3 people have lost their lives to the disease, bringing the Queensland total to 29 deaths. One of those was a person in their 60s, one a person in their 80s, and one a person aged 103. There are 670 patients in total in hospital, including 49 in ICU. There are slight increases on the last figures reported. 33 of the cases in hospital are, 33 of the cases in ICU are non-ventilated, 16 are ventilated. To give you a sense of that, 670 beds is roughly the equivalent of a major teaching hospital. There are 50,689 COVID care patients at home being taken care of at home. 91.55% of the eligible population over 16 have had 1 dose of vaccination. So all we need is for all of those people who've had their first dose to get their second dose, and we'll achieve our 90% target for vaccinations. We're currently at 88.65% of eligible Queenslanders 16 plus fully vaccinated. We received into our Queensland Health Distribution Centre 148,000 rapid antigen tests on the 15th. They will continue to be distributed out to HHSs to be available at our testing centres run by Queensland Health. Yesterday afternoon, late yesterday, a tsunami warning was issued after a volcanic eruption near Tonga at roughly 3 p.m. There have been no reports of implications, no reports of significant impacts on the Queensland coastline, and that tsunami warning was cancelled at 9:30 a.m. I'll ask the Chief Health Officer to provide more detail on the COVID update.
Thank you, Deputy Premier. So sadly, we have 3 deaths to report today. 1 person in their 60s, 1 person in their 80s, and 1 person over the age of 100. All of these individuals had significant other medical conditions. Of these people involved, 2 had had a single dose of vaccine, and 1 had received a double dose of vaccine, but quite a few months ago. So I use this opportunity to remind everybody of the importance of boosted vaccination, receiving your 3rd dose if you are entitled to it, which will be 4 months after your 2nd dose. So we now have a total of 670 people in hospital, of whom 49 are in intensive care, and this continues to creep up, again a little bit over yesterday, not explosively, but it creeped up a little bit over yesterday. So I'll remind you that yesterday we had 649 in hospital, now 670, and 49 in intensive care today. Yesterday it was 46. 16 of the current people in intensive care are on ventilators. These patients are distributed in hospitals right across the state, in all hospitals right across the state. So it is everywhere. The greatest pressure remains on the Gold Coast and Brisbane south of the river, but cases are now in hospital right across the state. Thank you very much. I'll hand over to the Deputy Premier.
Questions? Dr. Gerard, myself?
Dr. Gerard, what sort of percentage of people in hospital are vaccinated?
No, we don't have I don't have that breakdown. Sorry.
What can you tell us about supply for young people getting their vaccinations? We're continually hearing that people who are booked are having their appointments cancelled because there's not supply that has come through yet.
Is this I've not heard that in public clinics. That's news to me. I'm sorry, I wasn't aware of that. In the public clinics, we have good supply. Okay, I was not aware of that. I will investigate that.
In terms of rapid tests, so we've got supplies arriving for the state-run testing sites. So what about people trying to get them at shops? When can they expect to purchase them?
Look, we have no control over that, and the supply of rapid tests these tests are in short supply around the world. If you look at the United States today, for example, they have exactly the same problem there. And what I said yesterday, at this stage of the pandemic, when the virus is so widespread, if you have symptoms which are consistent with COVID-19, then you should consider yourself positive for COVID-19 if you can't get a test easily. We encourage you, if you have symptoms, to go to a clinic to have a PCR test, and you should be able to get a PCR test there. The rapid antigen tests through private sector, as you're well aware, are very hard to come by. But if you have symptoms, that is sore throat, runny nose, headache, maybe cough, muscle aches, sometimes diarrhea, particularly with the Omicron variant, then you should consider yourself positive and isolate yourself at home. And again, if I could emphasise, if you do have COVID-19, whether it's diagnosed formally on a test or you work it out based on your symptoms, then there's no need to panic about that. The majority of people, if they're in good health and vaccinated, will have a mild illness. I really must emphasise this. So we've had a lot of calls, it's right across the country, for very minor things, minor aspects of COVID-19, with patients with very minor symptoms, or even just people calling the ambulance centres asking where to get a rat test. The majority of people, if they're in good health and are vaccinated, will have a mild illness. Now, a mild illness, I guess, to me, means it's not severe enough to go to hospital. Now, what I consider a mild illness and what other people consider a mild illness might be slightly different. So you can, even if vaccinated, have an illness which consists of, you can get a fever, particularly for the first 24 hours. You can. We see that in healthy adults. And you can have quite a severe headache for 24, 48 hours. We start to worry if your symptoms aren't clearly improving after about 2 or 3 days. You may not be 100% after 2 or 3 days, but you should be recognising significant improvement in your symptoms after 2 or 3 days. And the other main symptom that we worry about, that I suggest that you call an ambulance for, is difficulty breathing. If you're having difficulty breathing, and that's if you're not familiar with what that is, that's that. If I can give an analogy, if you're walking around the house, maybe walking 40 paces around the house, and it feels like you've climbed a flight of stairs, and you're short of breath after walking around the house, then that's the sort of symptom that is of particular concern to us, and in that case you should be considering calling an ambulance. Other significant symptoms that we often look up, might consider in hospital, are if you have significant chest pain, not just a little bit of chest pain with coughing, but significant chest pain. Perhaps sometimes we see people coughing up blood. We like to see people who are coughing up blood in hospital, and also people who might have a fainting episode. Again, that group we should be seeing in hospital. The main symptom that people get when they're getting severe COVID is this difficulty breathing, such that when walking around the house it feels like you've climbed a flight of stairs.
The Deputy Premier said that we've got about as many hospitalisation figures as a major hospital.
That's correct.
How is the capacity going right now? Have you done modelling as to how much you can take over the next few days?
Yes, we have done modelling, and we have the capacity to take at least in the thousands. Okay, so across the state. So we have that capacity, particularly seeing we have involved the private sector in assisting us in looking after other patients for the most part. So that certainly is a help. But we have the capacity to look after patients in the order of thousands, and our modelling suggests that the public hospitals, with the assistance of the private hospitals, will be able to absorb the load in the coming weeks. Now, the biggest pressure, as I said, at the moment is in the Gold Coast and the South Brisbane hospitals, and there's no doubt they are under pressure, and my thoughts are with the staff in those hospitals looking after significant numbers of patients, particularly seeing there are quite a significant number of staff, particularly nursing staff, who are quarantined because of exposure in their own home. So most of the exposures to hospital staff is from family members. It's not generally infection acquired or exposures in the hospital. It's mostly, like all of us, a family member comes home with COVID, and then they may need to quarantine.
How many staff are now in quarantine or?
I have that number. If I can just find it. So we have 2,643 hospital staff or hospital and healthcare staff who have been confirmed as having COVID. That's Queensland Health staff, and 2,835 Queensland Health staff who are in quarantine because they are close contacts of a household member.
And are you shuffling patients around from hospital to hospital, or is it just whichever hospital is closest is taking COVID?
No, we're not doing that at the moment. That hasn't been necessary. The intensive care units particularly have that capacity. We do that normally when one intensive care unit is overloaded. We might direct an ambulance or if it's a retrieval by air ambulance to a particular hospital. That hasn't happened yet. Because if you look at the numbers so far, and it is early, the numbers in intensive care, we're only talking at the moment 49 patients in intensive care and only 16 on ventilators. Now, that's not a huge number by Queensland Health standards. I think the hospital with the most intensive care patients is Gold Coast, and I can't remember the number exactly. I think it was over. I can't remember. It was 20 odd, but it was certainly within their capacity.
And what about the regional hospitals? How are they faring? Like, we know there's lots of capacity in, say, what you said about places down here. What about those regional?
So far, their numbers are small. They have that. If you look at regional areas, they have like 1 or 2 patients each. So that's the main impact at the moment is the metropolitan area.
Deputy Premier, can I just ask? A couple of days ago, you said that. The Premier said that you would give an update on Wellcare. Where is that at? Where is Wellcare at?
Yes, so we'll have meetings in coming days, and I will provide that update later in the week. The major construction is completed, as was programmed by the end of the year. There are still some finalisation works on the administration building and the reception building. Obviously, they're critical to its operations. Police and health are working together to operationalise the centre, and we expect it to be available in coming weeks.
The opening date was scheduled to be mid-January, though. Does that mean that they pushed back the opening date?
We did have some weather delays. As I say, the major construction on the accommodation was completed on schedule at the end of the calendar year last year. It's now available to us, and we have staff in there operationalising the centre. Clearly, over time, the usage of a facility like that is going to change as we've now met those vaccination targets, and there's less requirements for example, domestic arrivals to have quarantine, and so we're just working through what cohorts will be best to utilise that facility.
Will international students still use the facility?
Well, that again depends on achieving the 90% target. But as you'll be aware, if we continue on our current trajectory, we would hope to meet that 90% target this week, and that would allow vaccinated arrivals from countries where their vaccines are approved by our TGA to not quarantine on arrival. But there will continue to be a need for quarantine for some arrivals, as well as for other cohorts.
Surely that's going to be a really small number of people too. That they're going to actually need welcome. I'm just thinking like the justification for spending that amount of money on that facility versus how many people are actually going to need to use that facility. Throughout
the last 2 years, there have been a wide variety of times where we have needed suitable, appropriate, custom-built accommodation. Throughout that entire time, I certainly wished we had a facility like this one. I wish we didn't need it. I wish we don't need it, but I expect that we will. If you think about, there might only be 1,600 odd people currently in hotel quarantine. That's significantly down on what we've had throughout the 2-year period. But there are many, many Queenslanders now in quarantine. There are many, many Queenslanders now isolating. Many of them might not want to isolate in their homes. They might be in a home with vulnerable people, with people who have immunocompromised diseases that cause them to be immunocompromised. There's a wide range of reasons why people are currently quarantining or isolating, and having a purpose-built facility like this available to us will allow us to provide accommodation to some of those cohorts.
To clarify that, what type of numbers are you actually expecting in the first open?
So we, stage 1 has 500 beds that's built
What
now.
numbers are you expecting to actually use? the facility?
Well, as I say, we'll have more clarity on that when we determine which cohorts are most appropriate to use it. We look forward to having it available. We also look forward to the Commonwealth Government's facility, currently under construction, I think expected to be available to us in April. It's not far from here in Pinkenba.
With that 90% double dose target, it's been inching so slowly over the last 6 weeks. Can you offer some thoughts as to why that has slowed down?
I might let the Chief Health Officer, he might have some thoughts on that as well. I suspect some people whose 3 or 4 week mark fell over the Christmas New Year holiday period, they might have been away, they might not have wanted to get their second dose at that time. I expect now that people are getting back into the swing of things, those people who've had their first dose will get their second dose, and that's all we need. All we need is those Queenslanders who've had their first dose to get their second dose. That will get us to our 90% target. Of course, from there, we want to keep vaccinating. We want the remaining 10% to get vaccinated. We want to get young people vaccinated, particularly as they start to return to school.
And before you head over to Dr. Gerard, can I just clarify? There are a lot of people who are unvaccinated who are hoping that when we hit our 9% double dose rate, that a lot of restrictions on them will be eased. For example, they'll be able to return to pubs, etc., etc. Will that happen?
There's no intention to that effect at this stage that I'm aware of. And so I would say to all of those who are unvaccinated, if you want to go to the pub, go and get vaccinated.
So we've heard about we've heard about the impact on Queensland Health staff. What about other public service departments? How short are they? And have you heard of any ministers that have had COVID and recovered?
I'm not aware of any of my colleagues, and I suspect they'd probably let me know. All departments, though, like the whole community, have been affected by both the number of people now who have had COVID and have had to isolate for that reason, as well as those who are close contacts. I think just about every Queenslander now would know someone who either has it or who has had to isolate because they're a close contact. That's what you would expect at this point in the wave.
Dr. Gerard, do you have any more details on the people who have died? Were they vaccinated, unvaccinated, double dose, etc.?
I think I gave that detail, but I'll go over it again if you like. So with regard to the three deaths today, two of them had a single dose of the vaccine, and one was double vaxxed, but that was quite a few months ago.
And males or females?
I'm trying to give as little sort of personal detail as possible, particularly given some of the age of these people. They're just a little bit too easy to identify.
Of the 29 deaths, how many have died in their homes?
I can't give you that number. I can look that. I can find out, but I can't give you that number off the top of my head. So go ahead.
And the actual deaths, are we talking about like cardiac arrest type of?
Again, it's a mixture of things. Pneumonia. I will say this, if I can just clarify, we are reporting the deaths as soon as we see someone who has died and has a recent positive COVID result, rather than waiting like a week or more for maybe a coroner's inquest or detailed report on these cases, just so that you can get an idea of the numbers. There are a few that have died in residential aged care facilities, some have died in hospitals, and a small number have died in their homes. Often, but again, it's usually people with, almost exclusively, people with significant medical problems. There have been relatively, can I say this? There have been relatively few surprises in the sort of person that has died from this illness so far. I did speak about a young man a little while ago who died suddenly in his home on the Gold Coast. That's myocarditis. We know that is a rare complication of COVID-19. That does happen. So as with when you have an epidemic that is involving probably hundreds of thousands of people, you're going to see rare complications like that. But most of the deaths we are seeing are relatively predictable demographically. Older people with severe underlying medical disorders, particularly with inadequate vaccination, those who haven't received the booster vaccination. The booster really does seem to make a difference. I know I've said this a few times, but the data is getting better and better. That booster really, it makes a difference to how severe the illness you're going to get and your chances of ending up in hospital or getting worse. If I can just say with regard to Wellcamp, there are quite a number of things that it could be used for, and it's just a question of trying to decide what that facility can be used for. It could be used to, there are household people, if I'm sick and I have a household member who has some immune disorder and I don't want to go back, so that's a good place to put them. Maybe if I'm positive and I'm in a hotel but I'm not really very sick, we could put that person there. There are quite an array of options that facility would enable us to do, and so it's fantastic to have that facility available, that resource available, and it will certainly, and particularly going into the future. So yeah.
So could just members of the public who have COVID could use that as a quarantine facility? We determined by Queensland Health. So, but say for example, there might be there are often circumstances where, for example, you have a household with more than one person in it, and one person of that household is sick, but another person might be very vulnerable. That might be the sort of person. I'm not saying that is these are the various options that we're looking at the moment, and it's the facility is so beautifully designed. It can cater for different types of patients, and it's very safe from an infection control point of view. So it's a fantastic resource to have.
Sorry, how long do you expect will be need to check in still? What's the utility of it given COVID is now so widespread?
We still want the check-ins for the moment. The check-ins, for one thing, connect to the vaccination passport. So that's particularly critical for hotels, clubs, eating venues, etc. So that's one useful thing they're good for. The other thing is where we're tracking a large outbreak, particularly, they're useful for that. But we're reviewing all these processes on a day-by-day basis. So.
What's the utility in making international pilots quarantine for 14 days when a COVID case only needs to quarantine for 7?
Look, all of these things are about to change. So within the next few days, all of this is going to change, as you've heard. We know we're heading towards 90%. In the next few days, all of this will change.
Deputy Premier, how much money did the Queensland government spend on the construction of the Deputy Premier?
How
much money did the Queensland government spend on the construction of the Wellcamp quarantine?
Look, as I've said before, the financial arrangements there are commercial in confidence. Our arrangement is a lease from the Wagner Corporation. We have a 12-month lease with an option of a further 12 months if it is required, and the lease arrangement represents good value when compared to the very significant costs that we've incurred renting out entire hotels for the best part of the last 2 years.
Can I just quickly ask you on a different issue? Tsunami warning for our part of the world and also for Norfolk Island. What communication have you had with Norfolk Island and what are things looking like?
We got an update from Norfolk Island late last night, which said that they had only seen a very small wave, effectively, from that tsunami. So we're not reporting any significant impacts on the Queensland coastline or Australian territories across the east coast. I understand there were some impacts in Tonga, but I'm not across the detail of those.
Is Queensland going to be sending any help to Tonga?
We always send help when it's asked for from our neighbours, but I'm not aware of any requests at this stage. And as I say, we've got police monitoring the coastline, and at this stage there is no reports of impact. The tsunami warning for Queensland was cancelled at 9:30 this morning.
The advice that you're receiving, is it an ongoing kind of situation if there's like an undersea volcano, or has the threat completely passed?
Look, I understand the threat to Queensland has passed now, and as I say, we'll look to get an update on our Pacific neighbours and see what impacts they've experienced. Thank you. Yeah, welcome back. Did you miss me? I've been
Do you guys want any overlay? We can do a walkthrough if you want it. Yeah?